Hello, this is Dr. Priyal Doshi, Doctor of Physical Therapy and a wellness consultant. I also specialize in women's health. And here we have our guest, Dr. Akash. Hey, Akash, please tell us a little bit about you.
Well, firstly, thank you, Priyal, for inviting me to the show. And your journey and experience has been incredible, especially when it comes to physiotherapy and women's health. And I'm super excited to be on this episode. I'm Akash, and I'm working as an AI scientist in a biotech company, which specializes in cancer research. And I got my PhD from Carnegie Mellon and UPMC Medical School, specializing in developing AI for breast cancer diagnosis. And I have been in this industry for little over 8 years now. And again, as we talk about several topics in today's podcast, I'm more than happy to go over some of the, like the myths and where we are with detection of breast cancer and how important is it. And I'm super excited to be on this show.
Wonderful. Thank you for being here, Akash. And so tell us a little bit about your experience in this breast cancer research diagnosis industry. I know you have done a lot of work related to AI too, so please share your experience.
Sure. So, while I was doing my PhD, so I specialized in breast cancer diagnosis, and it was mostly motivated by a personal reason where one of my family members was wrongly diagnosed with a certain type of cancer. So I was intrigued and interested to know why there is so much of misdiagnosis that happens, in for breast cancer. So it's very interesting that every year in US close to 1 million women undergo breast biopsy, and it so happens that anywhere between 48 to 52% of the time it's wrongly diagnosed. So what I mean by that is the patient is either underdiagnosed or overdiagnosed. So again, for me, the motivation was why is it so complicated for diagnosing cancer in the pre-invasive stage, and adding to that, like, why is early detection so important? So uh, throughout my work, I have tried to find answers to these questions, and I have come to a stage wherein I have realized that detecting the pre-invasive cancer is difficult, but I think even more important is for a woman to go for early detection, especially when they reach the age of 40 or 45, to rule out any complications further on. So again, early detection is the key, and to reduce complications in the future.
Yes, that's true. All right, so Akash, I'm gonna go through a few questions and we can just discuss on those topics. All right. So my first question is, there is a common myth that only women with a family history of breast cancer get breast cancer. Is this true?
No, I think yeah, the simple answer is no. And so genetics do play a very important role in the cancer progression for the future generations. But there have also been studies that show that depending on your lifestyle and your nutrition and the good habits that you have, you can alter your genetic makeup within your body. So now, again, if there has been a family history, yes, you might be susceptible to the disease, but that doesn't mean you will also get that disease. Again, this could be sort of like a factor to consider for you to go for that early detection, but it's not the case that you will get that disease. And again, the lifestyle changes that you make for yourself, uh, it just pays off in a positive way.
True. So it is said that while a family history can increase the risk, about 85% of women diagnosed with breast cancer have no family history of the disease. So it's important for all women, regardless of family history, to be proactive about breast health and screenings. Right.
Absolutely, absolutely. Can't agree more to that.
All right. So now let's go to the next question. What do you say to women who believe that a lump in the breast always means cancer?
Well, I think it doesn't mean cancer. Again, I was talking about the pre-invasive. So there is this there is this paradigm that a breast goes through, right from being normal or benign to invasive cancer. So a lump could also mean, it's a precursor lesion which might have the chance to progress to becoming cancer in, say, 4 years or 5 years down the line. But again, that's a factor which you shouldn't ignore. And I think going to see a physician or getting that biopsy done is crucial. But there's nothing to be worried about it, because uh, it's quite common. It's not an uncommon thing for a woman to see or have during their lifespan. But I think it uh, directs more towards being a precursor lesion than cancer. So now, if you just remove the lump, you're free of cancer. It's
Right.
that easy.
Right. It can be benign. It doesn't have to be
Exactly.
cancerous all the time.
Exactly.
All
Exactly.
right. Great. So, well, same points that I want to discuss as well. So let's move on to the next question. So another myth is that only older women get breast cancer. Is that true?
Well, in today's generation, no. And I think so. This question also came up at a women's health conference just last week, wherein the study shows that younger women are, getting breast cancer uh, more frequently than older women. And it's about, again, the lifestyle changes and the diet, like eating processed food, staying in an artificial environment, not going out, getting the natural sunlight, and all that are some of the triggering factors. And it's more common now to be exposed to that than, maybe 15 years back or 20 years back. So what we're seeing right now is, younger women are diagnosed more often with breast cancer than they were like 20 years back. And again, I think we discussed this early on. It's also about the right decisions that you make for yourself, uh, taking fitness quite seriously, getting that 130 to 150 minutes of exercise every week, and slowing down on eating processed food and going for, organic foods, and the real organic foods, and not just the foods which has an organic label on it. So I think all that is important very early on in your life, like especially when you're in your teens or in 20s. I think all these good habits will definitely lead to a positive impact in the future. So I don't think like younger women are safer uh, based on in today's generation. I think even they're equally susceptible.
Right. So the breast cancer can affect women at any age. And although the risk increases as women get older, in fact, 1 in 8 women will be diagnosed with breast cancer in their lifetime. That's what research says. And this includes women under 40 as well. So it's crucial to stay vigilant about breast health at all ages.
Right.
Right. Okay, so now we will go on the importance of early detection. So, how can regular screening and breast self exams help with early detection of breast cancer?
So I think getting the ultrasound or mammograms at the age of like 40 is sort of a good checkpoint to detect early stages of cancer. And right now, when you go for your annual physical exam, apart from all the blood tests that they do, they also check, for example, for cervical cancer, and women are also advised to get the HPV vaccines and all that. So I think now there are few medical institutions who are also proposing for a woman to get a like a breast health examination once they reach 40. And I think again, uh, that doesn't take away much from you, because it is, good to be safe than sorry. And early detection is the key, because I think at the initial stages it is very easy for treating and the prognosis of it. But as it progresses, and the progression is slow, it doesn't mean like within a year it progresses to invasive cancer. It takes like 5 years or 7 years or 10 years in some cases for it to progress to become invasive. So I think early detection is important, and I would like suggest to talk to your primary care physician about this, and check like what are the examination that you have to undergo. So
Right. So the self-exams, right, are also important as they allow women to become familiar with the normal texture of their breast, making it easier to spot any changes. And women with dense breasts may need additional imaging like 3D mammograms, ultrasound, or MRI to improve detection.
yes, absolutely. And also, Priyal, I think through this podcast, I think we are creating like a general awareness, which many people might not know, just because there is like, so much less that's being spoken about in the public media. So I think through this, and huge thanks to you for creating this awareness to the women in our lives who can, benefit from this.
Right, I agree. And thank you. Yes, that's the purpose of this podcast, to spread awareness about the topics that are the topics that are not being discussed as much. Right. So, all right. So let's move on to the next question. I think it's going to be interesting and probably controversial for some people, but I think it's a good topic to have a discussion, just to kind of spread awareness and curiosity. So, can breast reduction surgery help reduce the risk of breast cancer for women with dense breast tissue?
So my answer would be no. And it's not about the surgery that you would go for. It's I think it's much more than that. It's not about the volume, but the health of the tissue at a microscopic level that affects, or has a big role to play if it becomes cancerous or not. And again, at a very high level, you might feel that this might be a solution, and I can be free of breast cancer throughout my life if I do this. But that is not the case. And that also, that doesn't give you the ticket to have wrong lifestyle changes, or going and eating processed food and not getting the exercise or the sunlight that you have to. That doesn't give you sort of a golden ticket to that. But I think still examinations are important, and there have been very limited studies which shows that uh, going ahead for this surgery actually avoids you getting breast cancer. And again, we are very far from proving that, but that is not the solution for the underlying disease that we're talking about.
Okay. But I do understand what I have kind of seen or heard, that breast reduction might offer some benefits, but it's not suitable to everyone. Now, women should consider it alongside their personal risk factors, including age, family history, genetic predispositions, and also the lifestyle, right? So those are the priorities. But when they are making all these decisions, they must consult their healthcare professionals to determine if it's the right option for their circumstances. Now, so breast reduction surgery can lower the risk of breast cancer for women with dense breast. That's what I kind of hear, especially in those over 40. So the reason behind what's being said is, by removing excess tissue, it can make it easier to detect tumor during mammograms or physical exams. So by removing or the breast reduction does not really solve the problem. It
Right.
just kind of helps with detection.
Right.
So we
Absolutely.
don't kind of misdiagnose, or we don't kind of miss the diagnosis of, just palpating the lump, or kind of being diagnosed during the mammogram. So that's the kind of a philosophy behind it.
Yeah.
And also, some studies suggest that removing a significant amount of tissue may lower the risk by 60%. I'm not sure how true that is, but please do not get biased by this sentence. And however, this should be discussed with a healthcare professional, as other factors like family history and genetics play a big role, and of course, the lifestyle, the eating habits, and overall lifestyle.
Yeah, yeah, absolutely. And again, the 60% that you just mentioned, it's based on a very limited study. And to reiterate, that doesn't give you a golden ticket to make, like, wrong choices. And because that will affect and increase the chances of any woman contracting breast cancer. And again, be watchful and be mindful. And we spoke about nutrition, diet, and physical fitness, but I think even mental fitness is very, very important, because that acts as like an absorption layer for everything that you eat and do, right? It's about your mental health. So I would also emphasize in either doing like mindfulness meditation, or need not be every day, maybe like just once a week if your schedule is very busy. And overall, I think when you feel healthy, you actually feel it. And that's when, the cancer, it just says goodbye. So I think keeping it simple, and, you'll have the best healthy life.
All right, very good. Well, so I think we are going to conclude our session here today. Thank you very much, Akash, for joining this podcast. Your knowledge is going to help everyone to kind of dive deep in this topic. They will be curious to learn more. And I hope we can do this again and spread awareness about the breast cancer health, and then also what steps women over 40 especially should take to prevent
Mhm.
and just kind of follow healthy lifestyle.
Well, again, thank you so much, Priyal. It was a pleasure talking to you. And, see you on the next episode.
All right. Thank you so much. It was a pleasure to have you, and goodbye. Bye-bye, everyone.